The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and again, welcome to our October 29 Safe and Calm webinar. We have just a few updates for you this morning, and it may not take up our usual hour, so we may be able to give you a bit of your time back today. We will be using our standard agenda with a very brief advocacy update, a quick look at the Michigan numbers, and we will focus on the recent epidemic orders that were issued later this week. And before we move on, we do want to remind everyone that there is no Safe and Calm webinar on Wednesday, November 4. We will be reconvening next Friday. So let's turn the presentation over to Dalton, our Director for Public Policy.
Good morning, everyone. Today's advocacy update is going to be very brief and is more of a reminder slash distribution of information that we received from MDHHS that you might find valuable, particularly around the PPE grants and the COVID-19 nursing home support payments that they talked about on yesterday's nursing home provider check-in call. Firstly, we've been talking about this PPE grant program for SNFs, where they're going to take this $20 million fund and divide that by the licensed beds and then distribute that money across the state to SNF providers. Yesterday, MDHHS reached out to us and actually gave us an Excel sheet that lists all the SNFs in the state, and it says exactly how much each SNF will get, and that is attached to this webinar in the handout section. It'll be an Excel document titled PPE Grant. I'll also be distributing this later via listserv, and if you can't find it, please feel free to reach out to me and I'll get that to you. Along similar lines, we also got a heads up from MDHHS that some nursing home providers have not yet submitted their letter for the COVID-19 nursing home support payments. This is a $15 million fund. You have to meet certain eligibility criteria and then submit a letter to the department. Those letters are due by the end of the day today. We do have some members on the list, and the email to submit those letters are right there. I've attached the letter that you need to sign to this, as well as the list of SNFs who have not yet submitted the letter to the handout section of the webinar. So please take a look at those documents in case you don't think you may have submitted your letter or can't remember if you haven't submitted your letter, because I don't want you to miss out on any potential funds. These payments will be sent out the week of November 2nd, and they're meant to be dedicated towards efforts to support the retention of frontline staff. And as I said, you'll find those two documents attached to the webinar today. Here's the list of criteria that you need to meet. You need to be a certified nursing home. Only class 1s are eligible. Can't be a special focus facility. You must have at least a 2-star quality rating. You must have at least 85 licensed nursing home beds, and you must have at least 25 total COVID cases. And that includes your staff and residents.
All right, thank you very much for that, Dalton. Before we get into any questions, each year Leading Age Michigan is thrilled to spotlight the new and innovative programs and services displayed by our business partners during the Solutions Expo at our annual conference. During this historic and challenging time, we would like to celebrate our business partners who have maintained their commitment to our members during our short delay. Please thank our business partners by supporting their programs when you are in need of their services. As of right now, it does not look like we have any questions, so we can move forward.
Dalton, this is your piece. I think the slide was misplaced.
That is. This is just the updated important date slide that we've had on the last couple webinars here. The big major update I added to this is that those nursing home COVID-19 support payment letters are due today. So please, please, please take a look at that Excel sheet, see if you're on there. I don't want you to miss out on any potential funds.
Okay, we're going to do a really brief situation update. We don't want to spend a lot of time this morning looking at data, but since caseloads and test positivity continue to rise, we thought that we should look at the Michigan numbers at least quickly this morning. So here is our routine graph for this Michigan 7-day rolling average of new cases as of yesterday. And you can see that we continue to overshoot the surge, the numbers that occurred in the spring, with the highest daily number in our history occurring yesterday. Our 7-day rolling average of Michigan deaths graphic is still looking like it's slowly rising, but of course it is still much improved since last spring. And a quick look at our Michigan Safe Start map. The colors still have not changed for weeks, but you can see that test positivity and cases per million are rising significantly almost each day. During our Wednesday report on the 28th, we had a 5.6% positivity rate. It has risen just in the past 2 days to 5.9%. And at the same time, and in the same interval, the caseload moved from 152.2 persons per million to 176.4 as of yesterday. So all the numbers are continuing to rise.
Just wanted to let you know, Deanna, someone said that the Michigan Safe Start map updated today. Just so you can take a look at that later.
Okay, great, thank you. This was as of yesterday. So a quick look at the Safe Start web page. This week, the department has now updated its My Safe Start web page to include the link to the county positivity rate. And that's now directly from the website rather than the press release that came out last week. Remember that the list that is linked here is the only rate that nursing home and long-term care facilities overall should be paying attention to when considering indoor visitation. Excuse me. For testing, you need to look at both this list and, if you're a nursing home, the CMS Nursing Home Compare website. We noted this week, and again, this is all as of yesterday, that we went from 45 counties who were level E on Wednesday. I'm sorry, Tuesday actually. They were level E on Tuesday to 50 as of yesterday. And of course, this is the highest risk level that the MDHHS categorizes. So a lot of increasing caseload out there. So we're going to move on to resource updates now. Yesterday, the department updated its epidemic order that increases restrictions on gatherings, with a note that large events are often the source of significant spread. So gatherings are limited to 10 or fewer in private, social, indoor, residential gatherings, and for non-residential events, limits are based on both social distancing and seating. All persons must wear masks at both indoor and outdoor non-residential events. For outdoor events, the formula is similar, with social distancing requirements based on availability for fixed seating and capacity. There have been a lot of handouts put out by the department for implementing this order. I think there's like 4 infographics or so. And we do not have those listed in our handouts for today because we had a limit as to number. But those infographics will be coming out with the video later. And of course, the link to the epidemic order is at the bottom of the slide. So there are certain situations that these capacity rules do not apply to, and some of those are listed here. You'll also find that one of the most controversial areas in this new guidance is a requirement that certain businesses, such as restaurants, hair salons, etc., must kind of log people in and out and capture their contact information for possible later contact tracing purposes. So there are some entities that are balking considerably at that. So we'll have to see how that plays out. There have also been some updates about nurse aide training. CMS recently extended its 1135 blanket waivers to January 21. Prior to that, they were scheduled to expire in November. And if you remember, there are some nurse aide training flexibilities that are granted through that waiver. The Bureau, however, is still working to get all nurse aides certified as soon as possible because they're saying that training and testing are readily available in Michigan. But in light of these rules, the Bureau has decided that any person who is working as a nurse aide and has worked for more than the 4 months that would normally be allowed under the federal rules can continue to work under that waiver flexibility, but they must be certified by January 21, which is the date that the blanket waivers are scheduled to lapse. But if there's a person currently working who hasn't worked their 4 months without certification, they are expected to become tested and certified before the end of their 4-month period. So all of this is on the BCHS website, and that link is at the bottom of the page. So I've also gotten recently some information that Prometric has tested about 2,400 candidates since the pandemic loosened up a bit, and there is still a waiting list of about 200 more persons. Because some of these candidates do not want to travel to distant testing sites, Prometric is willing to open more sites if there are facilities out there willing to test any person other than their own candidates. So any facilities that might be interested, they can contact Prometric at the address that's noted here. So before we move on to the new testing requirements, which is going to be the bulk of what we're talking about today, let's see if there are any questions.
All right, thank you, Deanna. Before we get into any questions, Leading Age Michigan wants to thank our business partners for their continued support during the pandemic, and we encourage you to take a look at the logos on the screen. These are the organizations that continue to support the association and your organizations as well. Without their continued support, the Education Foundation would be unable to be as dynamic and innovative as we are. Therefore, when you are considering a purchase of goods or services, please remember this page of logos and consider making a purchase from one of these fine organizations. We do not have any questions right now, so we can keep moving.
Okay, so on to testing. Excuse me, this Wednesday, MDHHS issued its testing order, which now includes all licensed residential care facilities for senior care. The state will support testing for all of these entities, both for staff testing and visitor testing. The list of circumstances for general testing, but not visitor testing. So this first part is just about general testing for residents and staff. The list is noted here. For nursing homes, this set of scenarios has been unchanged, and so this is just now being extended pretty much to HFAs and AFCs. So facilities must, 1, test initially. And of course, all nursing homes have pretty much done that. Some HFAs and AFCs have also done this initial testing. We're aware of some. So facilities will just need to ensure that all staff and residents have been tested at least at some point since March. The second piece is, of course, any staff or resident with exposure to COVID or symptoms of COVID must be immediately tested. And if there is an outbreak, and it's important to remember that the definition here for an outbreak is just 1 or more positive cases in staff, any staff, whether you consider that they caught the infection in your facility or not. So any 1 or more positive staff cases and any one or more resident cases would be considered an outbreak. And of course, for that, you must continue testing of all residents and staff weekly until 14 days pass without a positive finding. You must test staff weekly, at least in any counties listed as risk level A through E. And I think this was changed from before. I thought that it said B through E originally for nursing homes. So I think this is a bit of a change. Unfortunately, sometimes the older guidance isn't available after they change it, so I'm not sure about that part. But at least at this point, if you're anything but low, a low-level county, you're going to have to do weekly testing of staff. You must test all new residents or returning residents unless they've been tested during the past 72 hours. And you must test all newly hired staff on their start date if they have not been tested within 72 hours. This verbiage actually varies a bit from the SNF original guidance, which stated that new staff must have a negative test prior to working in a resident care area, which of course would be a prudent practice. The guidance don't really conflict, but one has more detail than the other. And the guidance addresses the issue of recovering persons. We get some questions about this piece. No one who is within 3 months of a positive test needs to be retested under any of these scenarios as long as they remain asymptomatic. If they become symptomatic, however, they should be tested and isolated immediately. In the guidance part that is specific for nursing homes, the department notes that they must continue to comply, meaning the nursing homes must continue to comply with both state and federal standards. And they specifically have to comply with state standards when they are stricter. That's not unusual, we anticipate that. No matter what the federal requirements are, facilities with risk levels A through E must test at least weekly. And the federal rule for testing in nursing homes twice weekly, if the positivity rates are higher than 10%, still apply. You'll remember that these are the numbers that you get off of the Nursing Home Compare website. Facilities in low areas are not required to test weekly by the department, but the federal rules still hold for them as well. Hospice facilities licensed as nursing homes, and that's an important piece. They have to be licensed as nursing homes, must comply with all of these nursing home rules in the same manner. The only thing that we're not sure about is hospice reporting. But with the use of point of care tests, we anticipate that hospices will likely have to start reporting as well, because there is no other way in these circumstances to identify the number of positive and negative point of care tests. The MDHHS guidance about reporting is under revision and unavailable right now, so we are looking for an update shortly. So these are the rules here for all facilities. You must obtain a consent, and of course you must have policies for any staff and residents who might refuse testing. You must follow the CDC precautions and protocols if you find any positive tests. And mostly we're talking about residents and staff here. If you find a positive test in a visitor, it's still not clear what you're going to be doing there. We're waiting for guidance from the state. The state will help with testing when needed to the point of their capacity. They always add those that disclaimer on their guidance. But requests for testing must be submitted, and there is a required form for that. The link is in our handout that we sent out with, actually that's on our screen here, under MDHHS testing resources. There's like 2 pages of links to all of the documents that surround all of the testing issues. If a facility, those facilities who need to be in compliance by November 4, reach out for help to the state, but are still not in compliance, and this is written specifically in the order itself, they will not be considered in violation. And that's an important point for types of facilities with later start dates as well. If it looks like you're not going to make these deadlines, you need to reach out to the state before that time. Otherwise, you're going to be considered in violation. So the state has some ability to help. If you don't ask for that help and you don't make the deadline, then you could have some difficulties. Nursing homes themselves must have already complied actually, with testing and visitor testing as of the date of the visitation guidance, which was October 21. HFAs are expected to comply as soon as practicable, but no later than November 18. And AFCs must comply, one, for certain scenarios, persons with symptoms, outbreak testing, testing of new or returning residents and new staff, no later than November 24th. But they have until December 2nd for initial testing and weekly testing of staff, when that is required based on the area that they're located in. A note which also appears to be for AFCs only, not HFAs, I'm sorry, AFCs only. Anyone going out for an overnight stay or going out for Thanksgiving must be tested prior to going out and on return as well. So for implementation, the department has rescinded the 6/15/2020 order. In fact, they've rescinded an awful lot of their old orders now. There are penalties for noncompliance with the order for testing. You should note that MDHHS will directly ship antigen tests to SNFs, HFAs, and AFCs who are affected by this order. And they're also setting up a system to refill supplies. And they plan to send a small set of supplies for confirmatory PCR tests. We're kind of looking for guidance about what that might look like, because it would almost have to be a point of care test, I would think. And there are some PCR point of care tests. So we're not sure what kind of confirmatory PCR tests they're anticipating here. We have not gotten further information about that yet. It is important that facilities know that they're not required to use the state assistance. And the state will reimburse for any testing expenses that are not covered by insurance if the state is not providing the test equipment and the test kits for you. So you can use other alternatives for getting testing done, but you still have to be compliant with the rules. The order includes some testing basics. So if you're not familiar with antigen tests or molecular tests, you should probably review. They have a long set of handouts, etc., that again we included in our handout for your review. The state does have a preference for point of care testing for facilities who cannot meet a 48-hour turnaround time. They're fully aware, as are the feds, that PCR tests are more accurate, but they're meaningless unless you can get testing done very, very quickly. And the more quickly you get your testing done, the more immediately you're able to act to safeguard the residents. Also, if you're using antigen testing, you should be very familiar with all of the protocols. And we continue to refer everyone to the CDC flow sheet for antigen test decision-making, specifically about when to use a confirmatory test. The guidance on antigen testing, and that is a link in our resources, it answers a lot of questions, some that keep coming up to us quite often. Again, the link for that is in today's handout, but it's important to note that, yes, you have to have an order by a clinician, But because of some waivers in Michigan, any nurse, RN, or LPN can order testing. So that's an important piece to remember, especially for HFAs and AFCs. They often have access to a nurse, but not necessarily easy access to a physician. Who can conduct a point of care test? Clinicians can, but it also says that anyone properly trained can do it. So as long as you can ensure and document that whoever's collecting specimens and doing the tests have been properly trained, you should be okay. Another thing is that the guidance itself talks a lot about when confirmatory tests are needed. And again, we think the CDC algorithm does a good job of identifying when that is. So facilities have options. You can ask for state assistance. They plan to provide BD tests or Quidel test kits for SNFs for nursing homes who already have machines. They plan to provide the Abbott Binax cart to other facilities, and those are even easier to use. There's no equipment involved, and they're actually more accurate than the point of care BD test or Quidel test. You still have to have a CLIA waiver. So if you don't have a CLIA waiver, you need to work on that. For supplies, to get further supplies beyond the first set that they're sending out, you should complete the state testing assistance template. And again, there's a link for that in our handout. You can use community sites for confirmatory testing if needed. You can use your own lab, etc. if you need to confirm some of these point of care tests. That's up to you. Or you can create your entire program, and you can do this completely outside of the state assistance, but you still have to comply with the testing requirements for both staff, residents, and visitors. Okay, reimbursement. The state plans that Medicaid and Medicare Part B should cover any of this testing that is based on the state health department or public health recommendations. Commercial insurance generally will not cover these things, and the state is prepared to assist with that. Any costs, in fact, that are not covered by Medicaid or other insurance must be submitted to the state, and that has to be done through SGMA. You have to be registered through SGMA in order to get your costs reimbursed for this. And SGMA is the state program for dispersing money. So the link for that and how to register is also included in our handout that we have provided as an attachment to the webinar today. And additionally, the state will reimburse each facility $22.07 per test if it's collected. So this is a specimen collection fee if collected by the nursing home. So this is the list of the many links and resource guides that relate to the testing guidance that we referred to, and it is this list that is in your handout for today. So in terms of reporting, and this was a scary issue for a moment on Wednesday when several members determined that they had not registered for the reporting program that is now required for HFAs and AFCs. So, and the department only gave providers a 1 4-hour opportunity on October 28th. So they have, in response to our concerns about that, they have provided information that there is going to be an additional opportunity on November 4. Again, that is only from 7 a.m. to noon. And note that you will be expected to report all your cumulative data that you may have over time. And of course, the link for that registration that you need to use for that November 4th day is noted here as well. So we have a few additional notes. An interim final rule was issued on Wednesday. And in general, this rule speaks to state flexibilities regarding COVID. And it talks a lot about vaccines and price transparency for tests. That's also a big issue with some people paying an awful lot for testing equipment and supplies these days. There is a CMS call about that today at 12:30, and the call-in number is there. But in general, there's little here that directly would affect our providers. The CDC has also issued a very brief update on reinfections. They continue to note that there have been confirmed reinfections, but at this point, they continue to be fairly rare. And if you want to review that update, the link is right there. Also, if you remember, CMS and CDC canceled their scheduled training for nursing home point of care reporting. It has now been rescheduled for later today and for Monday. Those are two webinars that you can register for, and they're the same webinar. They're not sequential. It's the same webinar that's going to be repeated. You do need to check the NHSN website to register for that. I don't have the link there for that. Abbott tests, I'm sorry, go back. Abbott tests have been issued to nursing homes by HHS who were in red or yellow counties. And they use the CMS county test positivity rates to determine that. However, one of the messages that we've gotten from CMS in the last, well, actually this week sometime, for any facilities who did not file for a CLIA waiver by September 30th, HHS says, and this is their quotes, they're welcome to purchase the machine from the manufacturer. In other words, if somehow or other you don't have a CLIA waiver in the process by September 30, you're kind of on your own to get your equipment. The next CMS nursing home call is on November 11, and MDHHS nursing home reporting has now moved to weekly, and that is going to resume on November 4th, if you remember. So we decided that there are a number of really important topics that we actually were not going to discuss in general today. We do know that there's still a lot going on in terms of guidance and confusion around recent guidance. But we also believe that if we talked about some of these topics, we would simply be hearing and rethinking questions that we know we don't have good answers for. There's an awful lot of guidance currently being developed and reviewed by the state, and we decided it would be best to wait for that for any further discussions about these major topics. If you believe you do have a burning question about any of these topics, so please email us using the Safe and Calm email address, or you can email us directly. Our addresses are always at the end of the slides. So provider relief grants. HHS, believe it or not, has again updated its FAQs since last we spoke on Wednesday. And it seems that this has become a very complicated process and one that is somewhat fluid. So we believe that our best strategy to address this is to schedule John Lonzak from Plant Moran to provide some training on the provider relief grants and the reporting requirements very soon. Care and recovery centers. Some of the language in the new law feels very restrictive, but the department is required to come up with their guidance by mid-November. So we'll wait to see what they are considering. They are currently in the process of setting up some CRCs, and they currently have 9 applications, and several of them have gotten their site visits, I think, this week and next. And we've made the department aware of some concerns on our part. So we're mostly in a waiting pattern to see what they do, especially as it concerns to individual facility dedicated units outside of the CRCs. For visitation, we submitted a significant number of questions about this to the state. We do believe that there were a lot of gaps in the guidance, but it's kind of understandable because the state doesn't understand how things operate on a day-to-day basis in nursing homes, and so there are always scenarios that they don't think about. But we are still waiting for the FAQ to be released. And finally, the FAQs on reporting. We talked about this a little bit earlier this morning. Have been removed from the website. They're in the process of updating that for HFAs and AFCs. So we have no informational support right now for questions about reporting other than the written guidance which is out there. And we all know that an awful lot of the information actually is in the FAQs. So the one thing about visitation that we can talk about today is the state updated page 1 of its infographic to make it more clear that all EOL visits are exempt from testing. Note, however, that they still haven't defined what an end-of-life visit is specifically, since they have recategorized compassionate care into 3 sections: end-of-life, hospice, and critical care. So we're still waiting for guidance on all that, but they did identify that end-of-life visits are exempt from testing in all areas. Okay, so that ends our content for today. We can take questions.
All right, we have a few questions, so I will just hop into those. Just a quick reminder before we do get into any questions, since we have had some people join since Deanna announced it, we will not be hosting a Safe and Calm webinar this upcoming Wednesday, November 4th, but we will be having another one next Friday is when we will be reconvening. So no Safe and Calm webinar next Wednesday. All right, so let me get the questions. All right, for communities with SNF and HFA in the same building, if there is a positive case in one area, is that considered an outbreak in the entire building, both SNF and HFA?
That is a question that we have submitted to the state. We're unclear about the answer, although we did hear on Wednesday that I think that one member said that they were informed that they did not have to consider them together. But we are waiting for official guidance on that.
In the 10/28/2020 testing order, it discusses changing testing frequency according to the levels low, A, B, C, D, E. How are facilities handling this, since the level can change daily from low to B to C, like it did for one of our facilities this week?
That is another question that we've asked the state about. Specifically, CMS, when it put out its testing guidance based on its county positivity rates, has an actual protocol for how you change. One of, I think, the state issues is that the numbers that they're reporting are not, the levels that they're making are not necessarily related to the findings from the day before. They are related to a 7-day rolling average, kind of like we report here, so that they believe that there is some stability in the numbers, more so than otherwise. But it is, you know, it still could go up and down every day. We anticipate that there should be like an implementation guide to that. So we've asked the department for that. CMS has protocol for it. We would anticipate that if it goes up, you're probably going to have to do testing immediately. But if it goes down, there might be a delay. That's what CMS is doing. The department may do something like that. I actually anticipate that there's been a lot of perhaps instability in the numbers, mostly because the rates are going up. The chances that the rates immediately go down, I don't think are very high. So I anticipate that everybody's going to be testing at a certain frequency for a while. But again, we have asked the question for that. We've asked for actually a protocol from the state, and we'll have to see what we get.
Did you say that one or more positives constitutes as an outbreak?
Yes. Now that's as defined for facilities in terms of response. So if you have an outbreak, which is one staff or one resident or more, that's an outbreak. Now, when the state, though, reports its outbreaks on the website, those are 2 or more cases that they have determined through contact tracing are related. So when the state says an outbreak on its website that where it reports numbers, that's different from what CMS and the MDHHS have determined as a definition for an outbreak. An outbreak is only one single case that's either facility acquired or a staff person in your facility.
So all SNF and HFAs have to test weekly no matter the risk level?
No, it is dependent on risk level. You do have to do your initial testing. I'm not sure what the context for the question is. I don't know if I said something that perhaps was confusing. But to be honest with you, the risk level that you have to use for that are A through E. I don't think there's any county in Michigan right now that is a low, or if there is, there's only one. So everyone's going to be testing at least a weekly rate. And if you're a nursing home, if your county's above 10%, you're going to be testing twice a week.
Okay. Do we know of only ALs with CLIAs? Do we know if only ALs with CLIAs will get POCs? When will ALs be getting POC from the state?
Yes, you have to have a CLIA waiver. I don't know if the state is checking for that before they send out testing materials. I do believe that, remember that when we say AL here, we're talking license. They are working on ensuring that they have the correct list. We heard that from them on, I think, yesterday's call, that they do have a sense of where most of the licensed facilities are, but they're working to make sure that they know where they all are. In terms of deadlines for getting your testing materials, I don't know of any. I do know that the state is fiercely working because they're extremely concerned about the caseload right now, but they did not give us any time parameters for that.
When they go out overnight, do they need to return to the observation area of your facility?
Well, the answer is no. Whether or not, I'm trying to think whether or not you're a nursing home or assisted living, but the answer is no either way. I don't have any, there are no requirements that anyone who just leaves the facility for a medical appointment or any other kind of visit has to be placed in observation. However, you do need to screen them closely for any potential contacts. And if you think there's been an exposure, that would be the thing that you need to do. And there is no requirement that I'm aware of, right now at least, that anyone leaves the facility would have to be placed back in observation. But they are required to be monitored closely in terms of vital signs and symptoms for 14 days.
Where is the information for the nursing home compare data positivity rate, and are we supposed to be utilizing this?
You are if you're a nursing home. You're not if you're an AFC or HFA. If you're a nursing home, the link is off of the Nursing Home Compare landing page under data reporting, and I think it's updated at least once a week. And I usually check it on Mondays to see how many counties have what kind of a positivity rate. But you're only required to really look at that if you're a nursing home.
Do you know if the state is assisting with Quidel test kit supplies? We are still unable to procure these despite many efforts to do so.
My understanding is that they are, and you just have to remember that you have to use the testing assistance template. And again, that is a link that is in our handout that we sent out that's on the webinar handout page here. and we will also be sending it out with the video later today. So you have to formally ask the state. I think they've been fairly responsive in trying to assist, but I'm not sure of any individual requests and their responses to that. But they are trying to get testing supplies out as soon as they can. And my understanding, Quiddell is included in the group.
Are HFAs and AFCs required to test visitors, or can they have visitors provide proof of testing and results?
Both. However, when we think about it, I think it might be a burden to require all your visitors to go out and get individually tested, considering they have to be tested pretty much 72 hours, within 72 hours before each visit. And the state really is depending on point of care testing for visitation, and actually staff weekly testing as well. They believe that, I mean, if you think about it, you'd have to, if you were a visitor, you'd have to think like perhaps a week in advance, because it takes a while to get a PCR test back from a lab. There are some labs that might be doing point of care tests, I'm not sure. But basically, it's going to take 3 or 4 days sometimes to get a test back, and they have to have that test within a 72-hour period of their visit, and then if they visit 4 days later, they have to start all over again. The logistics of that are a little difficult. I suppose it could be done, but the state is really expecting point of care tests to be used mostly for this.
Do we need a separate CLIA waiver for a nursing home and assisted living? We have one that lists our overall organization name.
My understanding is that if your TIN number or your organization umbrella covers both entities and the CLIA waiver documentation covers both entities, you're good to go.
Do you think there are pros and cons for using SOM for your testing, or is it preferred to have your own process? Wondering if there are benefits to one over the other that are not obvious.
This is a personal opinion on my part. I guess I just feel that why turn down free supplies? Why turn down assistance? I do think that I would probably go with the state if I could. I mean, the state is not going to provide everything. I mean, some of the testing, such as for new admissions, etc., they'll reimburse you for it, but they're not going to organize it for you. They're not going to work with your lab, or they will provide point of care tests for it. So you kind of you're going to have to use both systems to some degree. But it just makes sense to me that using the state system, as long as they're responsive, and to my understanding, they have been pretty responsive, I would use the state system. But again, I'm not a facility. You know, I'm reading guidance and talking to people. I don't have any hands-on experience about what's working out there and what doesn't. That's where you all are really the experts.
Are you aware of another option for the CMS NHSN training? Both sessions that you just mentioned are full.
Wow. Well, no, I'm not aware of any. I suppose the thing that we can do about that is raise that level up to leading age. They talk to HHS and CMS frequently. So we'll raise that up to them and see if they can negotiate another session. Or another possibility is perhaps they'll record the session.
I have had an active CLIA waiver for years and I have received nothing.
Well, I don't know if you're a nursing home or an HFA or an AFC. What you would have received to date could have been, from the feds at least, has been based on the transmission levels in your area. Some people receive supplies because they had high outbreak numbers. So it's not necessarily a given that just because you have a CLIA waiver that you would have gotten any supplies. and it depends on what kind of facility you are. If indeed you're waiting for something from the state as an AFC or HFA, they haven't got their arms around that all yet, but they're working on it. So if you don't get what you need to do it soon, there is an MDHHS email link in that handout, and you need to let them know what you think you need, and I would do that sooner rather than later.
Do the recent gathering restrictions affect independent living communities who have been allowing limited communal dining based on the emergency order, which referred facilities to the CMS guidance?
I don't think so. I did read the newest gathering order. I didn't see anything pertinent for congregate residential settings there. I would have used the CDC guidance. I think that's what's expected.
Is there any requirement to test transportation drivers?
Are they routinely coming into your building? If so, do they have direct resident contact for at least 8 hours a week? That's the MDHHS rule as we know it right now until we see further visitation guidance updates. So they would have to pretty much be in your facility once a week for 8 hours or more in order to require testing.
If we need more supplies for our POC machine, are you saying we should fill out our testing assistance request template or just find our own?
If you can find your own and that works for you, that's good. I would rely on the state first. They're supposed to be reimbursed their costs either way. If it works to request it from the state and they're responsive and they get you your supplies on time, I would use them.
When should we expect POC from the state and AL?
Again, they're just getting their arms wrapped around that. I would expect sooner than later. But if you don't get it, if you don't get your supplies or whatever you need by the time getting close to your deadline for compliance, then you need to use the address that we have included in our testing resource handout and a request for testing support template and let the state know that you don't have what you need.
This is sort of along the same lines, I would assume, but I'm just going to ask it anyways. Is there a way to get a second POC testing machine to use at our HFA since we're both under our organization's umbrella and we only have one for the nursing home?
We have forwarded that question a couple times to Leading Age. We've not gotten a good answer, and those scenarios are mostly about having two nursing homes under one umbrella. I've not gotten a good answer about that. I anticipate that you might not be able to get a second machine unless you go to the manufacturer and buy it yourself. We've not heard anywhere that they have provided more than one machine, so that might be on your own.
How can I find the updated visitation infographic? When I Google it, the old version keeps coming up.
Okay, so I find all my resources pretty much by Googling for MDHHS coronavirus. When you Google that, the landing page will come up. If you click on the banner, which is about coronavirus, you will go to the second page, and that's the page that has the data on it on a daily basis. At the top of that page, click on resources. And when you click on resources, a large number of things will come up. And if you look at epidemic orders, emergency orders, they will come up in order. Most recent first, and the infographics are there.
Our ADL,
I'm sorry for the complication of that.
Are ADL visits classified as compassionate care and allowed during level E, provided visitor is tested?
They are not categorized as compassionate care, but they are allowed in all levels, and visitors must be tested in level E.
All right. As of right now, it does look like that was our last question. So if you do have anything else come up after the webinar has concluded, feel free to shoot an email off to Dalton, Deanna, or our safe and calm at leadingagemi.org email address, and we will make sure to get those answered for you. We will be sending out all the handouts attached, as well as a recording later today, probably I would assume within the next couple hours. Also, another quick reminder that we will not be holding our Safe and Calm webinar this upcoming Wednesday, November 4th, and we will reconvene on Friday. I believe that would be the 6th then. Other than that, we would like to thank Deanna and Dalton, and we would also like to thank our 95 members and participants that took time out of their busy schedules to join us for today's webinar. We appreciate everything you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. I hope everyone has a great remainder of their Friday and has a nice weekend. Other than that, I think that is it for me. Dalton or Deanna, do you have anything else you'd like to add?
No, have a good Halloween, everyone.
Thank you.
And a
Yeah,
safe one.
happy, safe Halloween. Thank you, everyone.